Have you ever had your heart suddenly race for no discernible reason at all? It can be pretty alarming as, say, your car's engine suddenly accelerating without your input. Now, while I don't know what's up with your car, when it comes to your heart, you may have a condition called atrial fibrillation.
The irregular pulse where there's no regularity to the rhythm, and that can contribute to little microscopic clots. And if those clots break off, that can contribute to the risk of a stroke. Many of those strokes are preventable by finding these irregular heartbeats, by doing echocardiograms, by doing EKGs, or just a basic physical examination. And the doctor realizing the pulse is irregular by examining a patient. So by patients, if they have palpitations at home, if they feel an irregular pulse in the chest, not just ignoring it, but having the doctor check and make sure it's not anything worrisome.
To understand how atrial fibrillation works, you have to first know how the heart functions. The heart is made up of 4 chambers. The upper 2 are called atria, and the lower 2 are called ventricles. Normally, blood travels from the atria to the ventricles. An electrical signal tells the atria when to pump the blood into the ventricles. Then the signal passes through a pathway called the atrioventricular node, or the AV node, and tells the ventricles to pump the blood to the rest of the body. When someone has atrial fibrillation, the atria receives chaotic electrical signals so that it's vigorously trying to push blood into the ventricles. That causes a rapid heartbeat. But the ventricles don't beat as rapidly as the atria, and that can cause problems bigger than just a fast heartbeat.
But if you do develop atrial fibrillation, an irregular pulse, and there's a big area of the heart that's not moving well, the blood can pool in that part of the heart. And by not moving thoroughly, the heart not being vigorous, the blood sitting there and pooling, you might understand that that can lead to a little localized clot.
Atrial fibrillation has no identifiable cause, though it is associated with many conditions like high blood pressure, chronic lung disease, and long-standing untreated sleep apnea. If the condition has occurred because it's linked to an underlying condition like a thyroid disorder, then treating the thyroid may solve the fibrillation. Other treatment options are medication, lifestyle changes, and surgery.
And it's only since the early 90s that many research studies have confirmed the benefits of blood thinners that can dissolve the clots and dramatically reduce the risk of a stroke. So the ability to use modern blood thinners to do a better job to prevent strokes has led to the increased awareness that atrial fibrillation and irregular pulse is something we should recognize, something we should treat, something that can pose a risk of a stroke, and something is one of the biggest previously not well recognized things that can make a difference to reduce strokes throughout the world.
Patients should also do whatever they can to control their blood pressure and prevent heart disease. This includes eating a heart-healthy diet, limiting the use of caffeine and alcohol, and quitting smoking. If these conservative measures don't work, then surgeons will step in with a number of effective procedures like electrical cardioversion, ablation, or implant devices like an atrial defibrillator or pacemaker.
There's been a dramatic improvement in technologies in the hospital that can try to minimize or almost cure atrial fibrillation. Patients may hear about the word ablation. Ablation is a technique in the hospital where doctors are putting catheters inside the heart. Atrial fibrillation is an irregular heartbeat. It's an electrical problem that occurs within the heart. We can what's called map these irregular heartbeats electrically. We can find out where in the heart these irregular signals are coming from, and a cardiology subspecialist called electrophysiologist can put special catheters in the heart and try to eliminate these irregular signals and dramatically reduce the risk and almost use the word cure atrial fibrillation. And doing that technique once, occasionally twice, can have a very high success rate at eliminating atrial fibrillation and therefore reducing future stroke risk.
It'll all depend on the individual's heart rhythm and symptoms. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.